Nurse Romaine has just got a report on a new postoperative patient. Mrs. Brown is a 34-year-old female who has just completed a total knee replacement. Mrs. Brown has never taken narcotics for pain. When Mrs. Brown arrives to the floor, Romaine's focus is getting her comfortable and reinforcing teaching on the use of the morphine pain-controlled analgesic pump.
The PCA pump is a very simple machine. This pump will give you a dose of morphine each time you press the button. However, you will only get a dose every 15 minutes if you press it. Mr. Brown, remember not to press the button for your wife.
1 hour after being on the floor, Mrs. Brown begins to complain of increasing pain. Romaine checks the PCA to evaluate how much morphine has been administered.
Mrs. Brown, you are not using your pain pump effectively. Remember, you can press the button every 15 minutes if needed.
I'm so sorry, but I think I'm falling asleep and forgetting to press my button. But when I wake up, I'm in so much pain. Oh, I still hurt.
I hate to see her in pain. Isn't there anything else we could do for her?
Let me try to reposition you in bed and adjust the straps in the knee immobilizer. Maybe this will help. How does this feel now?
A little better.
Maxine, honey, don't worry. I will be here for you and I will help you with your pain.
Mr. Brown begins to press the PCA button for his wife. 20 minutes after leaving the room, Romaine hears the pulse oximetry monitor alarming. Upon entering the room, Mrs. Brown's respiration rate is 8 per minute. She's pale and she only responds slowly to tactile stimuli. Her blood pressure is 70/40. Romaine is aware of the standing order for Narcan intravenously for respiratory depression. Romaine calls for assistance for a charge nurse, Rona, who quickly gets the Narcan from the McKesson dispenser and also calls the house doctor. In the meantime, Romaine places Mrs. Brown in a Trendelenburg position. Romaine's heart is racing at this point because her patient vital signs are getting worse. Rona administers the Narcan to Mrs. Brown, and she also receives an order for Levophed intravenously because of the continuously low blood pressure. 5 minutes after administering the Narcan, Mrs. Brown begins to wake up.
I am so sorry for hitting that button. I was just trying to help my wife. I hope nothing seriously happens to her.
It is okay, Mr. Brown. Your wife's vital signs are improving, and I'm sure she will be better soon. The medications I have given her are now starting to show effect.
It is important for the nurse not only to control the patient's pain, but also to be mindful of the patient's safety. Controlling pain with the use of pain narcotics is essential, but it is not the only way. Nurses should also use other techniques such as repositioning, ice therapy, assessing bandages for comfort, and providing a calm and peaceful environment that affords rest. Education of the patient is important, but education of the family member at the bedside is equally important. Mr. Brown probably wouldn't have continued to administer morphine to his wife if he fully understood the side effects of the drugs. Morphine is considered a strong opioid. They are used to relieve pain. One of the most important concerns during the postoperative period is respiratory depression. The nurse implication when administering morphine immediately postoperative is the prevention of respiratory distress. Continuous monitoring of pulse oximetry, respiratory rate, and the level of consciousness is imperative. However, at the first sign of respiratory depression, morphine must be withdrawn and the use of an opioid antagonist is inevitable. Along with respiratory depression, morphine can significantly lower blood pressure. Excessive stimulation of histamine receptors will reduce peripheral vascular resistance and subsequently lower blood pressure. Narcan is classified as an opioid antagonist because it simply blocks the effects of opioids. This drug is important to have on standby when the risk of opioid overdose is high, especially in postoperative situations. Though effective, it is important to use with caution because it can totally reverse the analgesic effects of the opioids. Nurses should monitor the patient closely after each Narcan is administered to avoid total reversal of the opioid antagonistic effect. Levofed is a generic agonist. It is the synthetic equivalent to norepinephrine. Levofed is effective in treating hypertensive states because it stimulates or activates the beta-1 receptors. Levofed adverse effects are hypertension and tachydysrhythmia. Therefore, it is important that the patient be closely monitored when the medication is administered.